Okay, so we've been family for a long time, haven't we, Vincent?
Very long time.
I mean, I think the first time we met was when you came to Malaysia with Lucy.
Yes, we did. That was in the 90s, I think.
I know you came all the way to visit your cousin. So Aubrey was my husband, and he's your first cousin.
Yeah, my first cousin. Yeah.
Been through a hell of a long journey with this hereditary condition.
Yeah.
You know, you've got 2 kids and I've got 4 kids, and with the genetic condition, you know, especially my concern would be for any 4 of them to be diagnosed with this illness.
Yeah.
And we've had a conversation within the family and the children, and we've decided that, you know, they do want to get tested. But as you know, with gene testing, it's a huge topic, isn't it?
Yes. It's a difficult one for families to decide when to get gene tested. I mean, my experience is that when I was first diagnosed, it was slightly different for us because the family already had it. My mother had it, so we knew potentially that we would get it.
Yeah.
But the doctors at that time, you know, we're talking 16, nearly 20 years ago.
Yeah,
So that hasn't been a long time. They suggested that not to be gene tested really until probably, because the onset of symptoms in our particular family version of amyloidosis presents itself in late 40s, early 50s.
For men, and the women's a little bit later.
Yeah, women, that's correct, that's true.
Because this is the Portuguese strain.
Yeah, 47. Yeah. And so they purposely had said, you know, don't get tested until probably early 40s because it has an impact. In those days, it used to have an impact on, once you know you've got something, even though you think you may not change, you do change because you know something that you didn't previously understand or know about. Also, in this world, you know, you're young and you want a family, you want to move forward in your life. So it's very difficult being diagnosed in those days because it had so much implications on getting loans, getting mortgages, health insurance, everything. These days it's slightly different, I think, in a lot of countries, especially most countries now. When you get diagnosed with a gene, counselling gene, you don't necessarily have to divulge that you've got a bad gene.
Yeah, well in the UK and the US, I guess.
Yes, but you know, it is a difficult one. But in these days, I would personally, I would recommend that they get tested as soon as they think they're ready to be tested. You know, not too late, especially looking at the trends in your family and when people start getting symptoms, but also young enough so you can adjust your life probably to work forward. So you can probably have your quality of life long term is better than probably that I had when there were in this world when there was no drugs or anything available to stop this or to slow this disease down. So it's up to the individual to understand that and to be mentally prepared, not just them but the family. Very important.
I think you mentioned ready, like with the 4 of my kids. When will they be ready? You know, I mean, it's a difficult one because I know of some family, particularly talking about in New Zealand context, we still don't have protection when it comes to revealing of the gene information, genetic test information, because insurance company, for example, they're still privy. They can be privy to the details of what came out from your results. So a lot of people are hesitant to be genetically tested, and this of course will include my 4 kids because, you know, they are Kiwi citizens. However, as a mom and as a patient advocate, and having been through this journey with my husband, late husband Aubrey, your cousin, I've taken the stance of telling them to be tested, only because I guess I suppose what you say is right in terms of like you have to be ready for it. And with my 4 kids, we talk about it and we're very open about it. And they've seen their father go downhill with
struggle
with the
with that.
situation,
We've all struggled. We've seen other family members as well
Exactly.
struggling and pass away because of that.
Because your twin.
My twin died. We've lost a lot of people, my mother and lots of other cousins to this disease. So, but I think also saying that it is a very difficult situation, and we're quite lucky in Europe because we have different methodology and improved drugs. But if you look at being able to be gene tested at the right time, it's not quite a right time or a wrong time, but I think be mentally prepared for it at whatever age. But also you've got to have that in your mind, the fact that if you get tested too late, you may not be able to get the benefit of possibly having drugs to countermand that particular disease. So it is difficult, but you have to be guided by somebody, whether it's family and also you need to take the opinion of doctors around you to give you that moment in time when you think, okay, I'm ready. And if you don't get tested now or whatever that time is, it may impact the rest of your life from a medication point of view, which it's seen now that by taking medication before you start getting symptoms, you can have probably a normal life, quality of life. You may not have to go to hospital so much. And so that's really powerful, and also that also shows that the next generation of family are going to be in a better position than we ever would have even dreamt of. Really. I think that's very important.
I think with our family, the good thing is that we talked about it.
Yes.
We're very open about sharing, because you've been there for Aubrey, both of you have been there for each other. How openly ready you are to talk about it, but not all families. I know of families in New Zealand that actually don't want to talk about it for personal reasons, which we understand. We completely understand why people are just because of the trauma of seeing how their parents or their loved ones suffer. They just rather not know. Especially in New Zealand, because what's the point? People have said, what's the point? There's no treatment. Why would I want to find out? Because that would impact my life, and then what? But would you agree that talking about it is so important?
I think talking about it's not just the disease that we talk about. It's like anything in life. Other things that come along in life that affects you. It's always good to share with other people, because it takes that burden, some of the burden away from you, and also speaking to somebody who's experiencing the same thing shows that you're not alone in this journey, and it's very important to share. And the more you can share and be open and honest with things helps other people as well on the road.
100%.
And that's what I've seen. And going back to your point about talking to other family members, can be difficult, because some family members are not quite ready to be talked to about it. Even with Aubrey for a little while, he was in denial for a little while. And it did take a bit of a jolt for us, to get to him and say, don't be nervous, don't be scared. We're all in the same journey together. So share and support is very important.
So true.
And most people, all they want to know is there somebody else going through the same situation and the same day-to-day problems or inability to do things, and share that. And so they're not alone, really, because
100%.
if you don't talk to other people, you become inward looking.
And it's so easy.
And it does destroy you mentally, probably
yeah.
emotionally.
Yes.
And you can get to a place where you can be very hateful about what you've got and then take it out on others.
Yeah.
So instead of talking to somebody, you take that hate on other people.
Agree.
So it's very important. But unfortunately, you do need to read the room, as they say, with families. But the more open you are, the more people trust you, and also if you're going through the same experience, makes a huge difference to that person.
And I always say that the good thing about having a hereditary condition is that you've got family members that can understand what you're going through. And I know Aubrey's very, very fortunate and grateful that he had you, even towards the end of his life, right? When he's got days when he just can't cope, at least you're there for each other.
Yeah.
And for me as well, at least I have Lucy, my wife.
Yeah.
Because we essentially go through the same thing.
Yeah, and on that subject, as a patient, we're always on that journey much quicker than
true.
than the rest of the family or the person who's your spouse or whoever it is caring for you. They have to kind of, because in my own journey, I feel that even though luckily I'm on drugs. That sounds bad, but I'm on drugs, on medication. Sorry, in the UK we say drugs, but the fact that I noticed for me personally that every 6 to 8 months my ability to do things changes, my body changes. So I'm already there, but the person who's looking after me or supporting me is not always quite there. So it's very important for you to share your experiences, the fact that you can't do this anymore. It's simple things like imbalance or, in the UK, cutting the lawn, for instance. Last year I could cut the lawn, it'd take me, small lawn, took me about an hour. Now I really find it hard to do it too much at all. So you have to, so you're on this continuous changing journey, which people have to catch up with you. And the only way they can do that is you have to explain to them and be truthful the fact that I can't do that anymore. Like picking up a cup, because with hereditary you have polyneuropathy, and in my case, in most cases, the polyneuropathy versus the cardiomyopathy is worse.
Correct.
Talking about wild type earlier, we were. People tend to forget, and it's very important, but people always seem to segregate between wild type versus hereditary.
Correct.
And really, in reality, they're very similar.
100%.
Because I get polyneuropathy, but also I've got severe heart cardiomyopathy. I have a defibrillator. I have atrial fibrillation, slow walking. So you can't really segregate those.
No.
And I think it's very important that you understand your changes that's happening in and be upfront, whoever's looking after you, to say I can't do that today, or I can't do that anymore, and make sure that you explain that to that person, because at the end of the day you have to rely on them.
Yeah, you do.
And also one of the key things that especially men find it very difficult to ask for help.
100%,
And if you look at the last generation, they're even worse. Even now, my wife's parents, they're in the 90s, and I have a stick now because I can't walk as well, balance, because the signalling from my legs are not as great to my brain. So I have to use a stick. So you have to consciously say, I can't do that today, I need a stick. They tend to think, oh no, I don't need a stick.
Correct.
You just have to get through that and say it's for a reason you need a stick. It's to keep balance. It only takes to fall over 1 second, and that could create a huge problem for you. So you have to be upfront. Don't be conscious that people see you differently. You just have to, because at the end of the day, I find that with this disease long term, people didn't expect me to last 2 or 3 years.
Exactly.
No, with symptoms, I've done over 16 years. And we'll touch base on that. Other things, reasons why I think I may have survived so long.
Yes.
But it's also one of the things is to have a positive attitude and share as much as you're feeling to whoever's looking after you or in your friends, because people never quite know. Because in reality, it's a hidden disease, really. Because outwardly, if you look at me, I look quite well. But inwardly and balance and everything, it's
declining.
It's very bad.
But you're really you've got a lot of clarity about your ability almost from one point to another. How did you achieve that that ability to come into terms with the deterioration that you feel in your body? And I'll say this based on my experience as a caregiver for Aubrey before as well, because initially when he got diagnosed, there was this huge fear in him because he saw his dad deteriorate, his grandmother as well, and his cousins around and just passed away. There was a lot of fear that came with that diagnosis. And I remember him going through a period where he actually got quite fearful and depressed, and kind of I could sense he was withdrawing from me, from the children, from friends. And I had to the good thing about, and you touched on this, the ability to openly communicate no matter how difficult it is. You have to kind of rise to the occasion as a caregiver, and I can only speak from a caregiving point of view, that you have to rise to the occasion, even though it's very difficult to talk about what you see in front of you, and you love that person and you want to be kind to that person, but at the same time you have to be open with what you see. And I remember telling Aubrey, are we not worth living for? I know you have this diagnosis. Are we not worth you getting up in the morning? And I think at that was the turning point for him, when he realized that actually there are people around me that care for me and love me. So how did you come into that? What was it similar, or
it's similar-ish, because I've always been a positive person.
Yes, you have.
And people are different, so
yes.
they take things differently in their life. So
we're just speaking from our point of
from my point of view. So in my journey, and the same as Aubrey's journey, before there were medication or not, we went through a similar thing in our life. Like, we had a liver transplant, which was quite a big moment in my journey, and that kind of set the scene. And it was quite a momentous time, and you do a lot of soul searching inside about your mortality, and other people supporting you, whether you're worth living. And I'm not saying it's easy, but you have to, and you do go you do go to a very dark place, and you become very insular, and it's all about me. But sometimes you got to crawl yourself out of that somehow, and to be honest, it took me several years to do that. And some of the reason why that was, I was coming to terms with the amyloidosis, the liver transplant, and also it's very good to have somebody like your spouse or somebody who recognizes the fact that you're going through this dark place. And sometimes I remember doctors saying, you've got to be cruel to be kind sometimes, from a caregiver point of view. And even today, my wife, Lucy, kind of says to you, you can do that. And it's so easy for the patient to say that I can't do that.
So true.
But you have to have that mentality to say, yes, I can really do that, and be positive, try and do that thing, whatever it is climbing the stairs, or simple things like walking a bit further, or getting up in the morning earlier than you would and stay in bed.
Yes.
Because if you stay isolated so long, that becomes the norm. So it is difficult, and I should say this. It's very important, and I've met a few patients where, especially men, where they blame other people for what they've got. I used to sit in my appointments and sit in the waiting room. I just used to listen to the patients.
Yeah, this is at the National Amyloidosis Centre in London. Yeah.
And a couple of times the male who has the disease was going at his wife. He hadn't come to terms with that. He was blaming other people's, and the wives took that.
Wow.
So, and I think it's very important, especially for men and for women,
Yes.
to recognise the fact
Yes.
that they need counselling.
Yes. So
It doesn't have to be. We talk about gene counselling. It's not
Yes,
gene
yes,
counselling.
yes.
It's just counselling.
Correct.
Whether by yourself or with your
important.
your soulmate or whatever.
Yes.
Don't be scared. Just because you're a man, it doesn't mean you're going to have a problem. It's very important to be open, and that's one of the good things. Be open.
Yes.
And it does bring out a lot of things.
Yeah.
Not just about your disease, but other things. So you have to kind of be ready for that.
Yes.
But it's very important, and I don't think I wouldn't be in the state I am today without having that journey of mental health and stuff. If I didn't have counselling.
Yeah, I think you touched on a very important topic: mental health.
Yeah.
Particularly for people like wild type, for example.
Yeah.
You're being diagnosed really late in life.
Yeah.
Where you think that you are going to enjoy the fruits of your labor.
Yeah.
You want to go for holiday, or you've got your grandkids to look forward to, and then all of a sudden you're diagnosed with this condition.
Yeah.
And you have no idea what it is, because and I can only speak from a New Zealand context. It's not well known.
No.
They are in clinic and they are told that you've got wild type amyloidosis.
Yeah.
And what you do. So I think the ability to be open, to talk about what you're going through.
Yes, because it's so new. People would forget that wild type is only really being discovered, or whatever you want to call it, in the last 5 years or less.
And it's because of the diagnosis, the machine that is now available.
Yeah, and also people are living longer.
Correct.
And and males. So from that point of view, if you get diagnosed, you've got to be it is so difficult to be positive at that moment in time. But what you have to think is that that's a very good thing about talking to other people in a similar situation, because, we as hereditary types, we've lasted far longer than we expected.
Very true.
And I think they have to take the same situation and look back to us to say, because they can do the same, but they have to be positive. And the fact that, okay, you're later on in life and you want to do things and you hoped you could do things, you can't, but you can still do things.
Correct.
But you need to do it differently, slower, or change the way you think of life, because you can't do things. I have the same thing with my wife, with Lucy. Because of all the things that are going on in your body, you have to do things different. Like pick up a cup. You can't take 2 cups. You've got to take 1 cup.
Yes.
If you're cooking or you're walking around, you're concentrating on trying to walk, so you haven't got the ability or the focus on doing anything else.
To pivot and do things.
Yeah. So people you have to tell these people that, because outwardly you don't look much different.
Exactly.
So they need to know that.
Yes.
And that's helped a lot.
Yeah.
And to be truthful.
Yes.
Because if you say you can do something and you can't, then they won't trust you.
No.
So you need to be open and say, and I've learnt that the hard way.
Sure.
And Lucy, you get told off.
Yes.
In
love, in kindness.
In kindness. And they, and sometimes you have to be cruel to be kind, as I said before.
I agree.
And it'd be great if you could be looked after full time, but
Yes.
that's not very good.
That's not the reality of
No,
life.
it's not
No,
real.
no.
And if you don't do things yourself
Yes.
and look at things, but you have to look at things differently.
Yeah.
And especially if you've been somebody very active in your life
Yeah.
and suddenly you can't do it, you have to look at other things that you enjoy,
Yes.
like, going to the cinema or
Yes.
going to play snooker or something which is not so physical anymore,
Yes, yes,
but
yes.
it gets you out of the house.
So true.
And always ask for help. Don't do it because you think other people think that
Yeah.
you're asking too much.
Yes.
Never think that. Just think
Yes.
that all people in my
Yeah.
life have
Yeah.
always been very helpful
Yes.
if you tell them the truth.
Yes. Yes.
So and you ask for help,
Yes.
and that's what I do. You get used to that.
Yes.
But never cry wolf.
No.
Okay.
No.
Because it's
Yes.
like anything really, isn't it?
Just basically
Yeah.
don't be a drama queen.
Yeah, and if you're have been a hard worker, it's like you were saying, and
Yeah.
use a lot of farmers.
Yeah.
I met a guy in Ireland who was a farmer, and he had wild type, and we talked a lot about being on the farm and everything, and he's had to relinquish what he's had to do to his son. You have to do that. You have to, otherwise you won't survive.
No.
Something will happen,
Correct.
whether it be something simple that you fall down or you've done too much.
Yes.
Because like Hereditary and wild type,
Yeah.
and we'll come on to this about exercise, the
Yes,
importance
yes.
of looking after your body
Yes. Yes.
is very important.
Yes.
Because if you don't do that,
Yeah.
then you'll be gone and somebody will miss you.
Agree.
So-
So I like we've touched so much just chatting about this.
Yeah.
The importance of communication, the importance of knowing your abilities, the importance of being open about your capabilities,
Yeah.
and finding strength in your present condition. And also understanding that there will always be people around you who are just looking to help you, but
Yeah.
so don't pull back because of whatever personal reasons.
Yeah.
And because just trust that they are there for you, and they rather you say something
Yes.
about that you're not able to do it than you trying to act as though you can
Yeah.
when you can't.
Yeah.
So it's a segue into what we're gonna
Yeah.
finish talking about, which is exercise. Like in our past conference, we had Ellen come and talk about exercise, and one of the things that the patients that attended the conference was very surprised is that exercise. I know one person said, "Oh, I thought exercise was doing the Jane Fonda workout," but it's not, is it?
No.
Like, to tell me what exercise and what helps you.
It's really, like all the changing things within amyloidosis on your journey, things change.
Yeah.
Things always are changing, not necessarily in the right direction, whatever direction.
Yeah.
So, but I've noticed, and I've been exercising for the last 10 years, really near since I was diagnosed.
Mm-hmm.
But what you've got to realise is that with the disease, it's muscle wasting.
Correct.
It's there's other things, and wild type people have similar problems because you're not.
Yeah.
You think, oh, we can't pick that up or pick this up.
Yeah.
So what you have to do, and we've worked on that, is to do exercise so you can go do the daily tasks that you would normally do.
Yeah.
It's not about losing weight, because we all know, especially on Hereditary,
Correct.
you don't have to lose weight because the disease does it for
No,
you.
exactly.
So, I've never had to do that. So, but on the other hand, you've got to really look at your body and say, look, I need to carry the bags from the shopping from my car. I have to get off the loo seat, and I have to walk over to there, even though it's only a few meters. How am I going to do that? My heart's not fantastic, your legs and everything. So you've really got to say, the only way you're going to be able to do that long term.
Have a cup of tea.
Nice cup of tea. Sorry. Never say no to tea. So So the best thing to do, what you're trying to do, is to do exercises that will keep you going on a normal basis. So what I do, I used to go to the gym, but that was more cardiac, so you can't do that because of heart failure, and also with neuropathy, you can't do that. So what we do now is we build muscle mass, because if you don't use it, you lose it.
Correct.
And if you sit down all day, your muscles in your legs and everything around here. So what I concentrate on, or Alan and I concentrate on, is upper body and lower body, and in between the two. But also some days he may come and I'm not quite with it, so you can't do the major lift, lifting a weight sat down, or bands, and I get bands. And also one of the big things is that if you have stairs in your house, it's very easy to do push-ups up the stairs, and it's only little and often. If you're going up the stairs several times a day, and we do find it hard, you should do 5. And so it's little and often. Or if you're doing exercise with a band, and you just pull the band over here like that, it's all this muscles here and here in your legs, and just a few squats and lying down and do that. And with polyneuropathy, and getting down and up is very difficult for the floor. So you can sit down and do these exercises. And the other thing that I would recommend, that I've only recently come into, is to go through your inhibitions about doing things and just do it. So I go to armchair yoga.
Yes.
Okay, which has been very important. So Alan, for instance, does all the upper body and the major muscles. But what armchair yoga does, it does wellness and all that as well, and breathing exercise. But also it does the minute exercises that you would not have time to do, or lifting your legs up, moving your feet, and sitting down, but your core body and everything like that, and also yoga poses, but not on the floor. And that just oils all your muscles, but you don't tend to do too much. It's not, you don't get breathless or anything like that. And also the wellness bit about the breathing exercises and just being quiet and mentally and everything, it does magnificently help you. And I think that's very important, to try and do both. But you have to, if you can't do it some days, and I find that we do something else, or we sit down and do breathing exercises, or a bit of Tai Chi, just the movements. It's just all about focusing your body. And also with neuropathy and polyneuropathy, it's very important, even though my legs don't work great, when you're holding onto a chair and you lift your legs up off your, I can't do that well, but it's the point that your brain is trying to get a signal to your feet to do that. That makes the whole difference. So because your brain is trying to make that connection all the time. If you don't do that, it will forget. So it's so important to do regular exercise, and it doesn't have to be much. Even if you're just stood in the kitchen, you can just put your hands on and lift your legs up, or anything like that. Or in bed, lying flat, you can push your knees up and your muscle on your thighs and everything like that. That all helps to oil the things ready for you when you want to walk or get up a chair. So I can honestly say, if I hadn't been doing that, I still wouldn't be. I don't think I'd be able to walk that well, unaided with a stroller. And I've met, it is so difficult. I've met so many patients where I've explained that to them, and they still don't want to do it. And I know it's very difficult to get through that mindset, but you have to do that, even if it's just a little bit. And some people, like most people, some people are very self-disciplined and they can do it themselves. But I'm not that sort of person, so I have to go somewhere to do it, or someone comes to me. And they kind of help you, because not just pushing you a little bit, but also support. Because if you trying to do something and you're a bit unstable, or they recognise the fact that you
Yes.
shouldn't be doing that today because
Yeah.
you did something like cut the lawn or something physically the day
Yeah.
before. So, but I can honestly say that's one of the best things
Yeah.
I've done
Yeah.
and continue to do.
And I'll just summarize everything by saying that intentionality and the positive attitude is what I believe keeps people going, particularly
Yes.
when you have a terminal condition, and you have to agree
Yeah.
at this point
Yeah,
it is a terminal condition unless it's a cure.
it's a long term, but
It's a drawn out.
drawn out, and I just need to say one thing.
Mhm.
Every morning when I get up,
Yeah.
I sit on the side of the bed and always thank God or whatever
Yeah.
to say, look, there's people out there far worse off
100%.
than you.
Yes.
At least I can get up. I don't have to rely on too many people.
Yes.
I can eat still. I can do that.
Yeah.
You see other people can do anything.
Exactly.
And so always remember there's always somebody far worse off, because that keeps you at a level where you don't feel sorry for yourself. Yeah, because it's so easy.
High five.
High five.
Love you, Vinny.
I love you too. Anytime.
Thank you.
And there's lots of other subjects. There's lots of other subjects. That's all right.
You said so many.